Thank you very, very much. No matter where I go or with whom I talk, whether it's small business owners or CEOs, doctors or nurses or patients, I hear growing concern about the crisis in our healthcare system, exploding costs, declining coverage, and shortcomings in care and prevention. Now, I have tangled with this issue before, and I've got the scars to show for it. But I learned some valuable lessons from that experience. One is that we can't achieve reform without the participation and commitment of healthcare providers, employers, employees, and other citizens who pay for, depend upon, and actually deliver healthcare services. We spend 16% of our gross domestic product, $2 trillion, on healthcare. And by 2016, health costs are scheduled to exceed $4 trillion, or almost 20% of GDP. If we spend so much, why does the World Health Organization rank the United States 31st in life expectancy and 40th in child mortality, worse than Cuba and Croatia? Our healthcare system is plagued with underuse, overuse, and misuse. It is, simply put, broken. As president, I will make it my mission to fix it, starting by helping the 250 million people with public or private insurance who face skyrocketing costs, inadequate care, and bureaucratic obstacles to coverage. Today, I'm announcing a 7-point plan to lower healthcare costs for Americans, and again to make our healthcare system, without doubt, from any corner, the best in the world. Building a national consensus around these cost savings is the first crucial step to covering all Americans with quality, affordable health care. First, we're going to focus on prevention, on wellness, not just sickness. Under my reforms, all Americans will have access to comprehensive preventive care, which will save money in the long run. The second way to bring costs under control is to bring our healthcare system's record-keeping into the 21st century, finally leaving behind paper records and outdated, obsolete 20th century information technology. Right now, if you're rushed to a hospital with a medical emergency, they may not be able to access your medical history or to find out what medications you're taking, what surgeries you've had, or even what your blood type is. Electronic medical records would change that. A RAND study found that as a nation, we could save more than $77 billion annually through the widespread use of electronic medical records. And these savings could double with the addition of prevention and chronic disease management. Third, we're finally going to coordinate and streamline the care our chronically ill patients receive. Americans with chronic disease, such as heart disease and diabetes, account for an astonishing percentage. When I first saw this, I couldn't believe it, that it was 75% of our national health care expenditures. And improving the quality of their care will help limit costs and improve health. To that end, I propose establishing medical homes similar to those operating right now in Oregon. Under this program, seniors with complex diabetes have had a 20% reduction in mortality, a 24% reduction in expensive hospitalization, and up to 42% improvement in control of their disease. Every patient should have access to a system with outcomes like that. Fourth, my plan will offer individuals and small businesses market access to larger insurance pools that will lower costs and end insurance company discrimination against people with pre-existing conditions. As part of a plan for universal coverage, which I will discuss in detail in the coming months, we would create large insurance pools that lower administrative costs for small businesses and individuals by spreading the risks. In a system of universal coverage, insurance companies cannot as easily shift costs through cherry picking and other means. Fifth, I will work to improve the quality of care, which will also help us drive down costs. I'll start by establishing an independent, public-private best practices institute. This institute would be a partnership among the public and the private sector to finance comparative effectiveness research so that doctors, nurses, and other health professionals, as well as consumers and businesses, would know what drugs, devices, surgeries, and treatments work best. This would reduce the use of inefficient and ineffective treatments. And I believe that it would have tremendous benefits because we could get evidence-based medicine into the bloodstream of the country much more effectively. 6, if we want to get healthcare costs under control, we need to get prescription drug costs under control. We know that Americans pay the highest prices in the world for prescription drugs that we have already, in most instances, funded the research on, funded the clinical trials on, done the FDA evaluation of, then we put it into the marketplace, and we end up still paying the highest prices. And let's remove barriers to generic competition. While 53% of all prescriptions are generic medicines, they account for only 12% of total pharmaceutical costs. A 1% increase in the use of generics could yield $4 billion in government savings. The final point that I would make today about lowering costs is to reduce costs through medical malpractice reform. While some have overstated the role that malpractice insurance plays in the healthcare crisis, I think we can all agree that we need reform that works for doctors and patients alike. I have offered one solution that has been used successfully at the University of Michigan hospital system. It's called the National Medical Error Disclosure and Compensation Act, as I have borrowed it from the University of Michigan to put it into law. It's a novel approach to improving patient safety and the quality of health care while protecting patients' rights, reducing medical errors, and lowering malpractice costs. This act would encourage physicians, hospitals, and health systems to provide liability protections for physicians who disclose medical errors to patients and offer to enter into negotiations for fair compensation. I know very well that every one of these recommendations will run into considerable opposition from forces that do not want change in our system. So I believe that equally importantly to having a plan, we have to have a political consensus. And that is what I'm trying to develop as I talk about health care and engage in a conversation with the American people. Because I think Americans are ready for change. They're ready for a health care system that produces better results at lower cost and ends the shame of us not covering 45 million plus of our fellow Americans. I look forward to your ideas about how we can pursue these goals, and I hope you will join with me in being part of this broad-based national coalition that will not only talk about and demand change, but work to make sure, starting in 2009, that our political system actually delivers the changes we all know our health care system desperately needs. Thank you all very much.